So next chapter is high order aberrations of the optical system including the eye. So in practice, the images formed by the various refracting surfaces or systems described in the previous chapters, they fall short of theoretical perfection. Imperfections of image formation are due to several mechanisms or several aberrations, and these have been analyzed in means devised to reduce or eliminate their effect. The refracting system of the eye is also subject to aberrations, but there are correcting mechanisms built into the eye itself. First type of aberration is chromatic aberration. When light is refracted at an optical interface, it is dispersed into its component wavelengths or colors, which we have discussed in chapter 3, dispersion. The shorter the wavelength of light, the more it is deviated on refraction. Thus, a series of colored images are formed when white light is incident upon a spherical lens. When lenses are used in instruments, it is desirable to eliminate chromatic aberration. So, correction of chromatic aberration by achromatic lens. The dispersive power, which we have discussed, the dispersive power of a material is independent of its refractive index. Thus, there are materials of high dispersive power but low refractive index, and vice versa. Achromatic lens systems are composed of elements or lenses of varying material combined so that the dispersion is neutralized. While they were all so in achromatic lenses, the dispersion is neutralized while the refractive power is preserved. So how this is done? It is done by combining convex lens of high refractive power and low dispersive power, convex lens of high refractive power and low dispersive power, and a concave lens of low refractive power and high dispersive power. The aberration can be neutralized by this way while preserving most of the convex lens refractive power. The earlier achromatic lenses were made by combining elements of flint and crown glass. Next is ocular chromatic aberration. Refraction by the human eye is also subject to chromatic aberration. The total dispersion from red to blue image is 2 diopter. Red to blue. Blue are more refracted while the red are less deviated. So the emmetropic eye focus the yellow-green 555 nanometer because this is the peak wavelength of the photopic relative luminous curve. The wavelength 555 focus lies between the blue and red foci, being as it is slightly nearer the red. So based on this, we have a test called Duochrome test. Based on this, we have Duochrome test. In clinical practice, the chromatic aberration of eye is made use in the Duochrome test. The test consists of 2 ranks of black Snellen letters. This is 2 ranks of black Snellen letters silhouetted against illuminated colored glass. upper rank is mounted on red glass, the lower rank is on green glass. Red and green are used because their wavelength, as you can see, they straddle the yellow-green by equal amounts, approximately 0.4 diopter on either side. So the patient views the letters by means of red and green light respectively and can easily tell which appears clear. The test is sensitive to an alteration in refraction of 0.25 diopter or less. A myopic eye sees these red letters more clearly than the green, while a hypermetrope eye sees these green letters more distinctly. The test is of particular use in the refraction of myopic patients who experience eye strain if they are overcorrected and thus rendered hypermetropic. So if the myopic patients are overcorrected, they are rendered hypermetropic. So then they force to use their accommodation for distance vision. Color blindness. The myopic patient must see the red letters more clearly than the green at the end of subjective refraction. Color blindness does not invalidate the test because it depends on the position of the image with respect to the retina. So, color blindness does not invalidate the test. A color blind patient should be asked whether the upper or lower rank of letters appear clearer. Next is spherical aberration. In previous chapter, the prismatic effect of the peripheral parts of spherical lenses were discussed. It was seen that prismatic effect of a spherical lens is least in this para-axial zone and increased towards this periphery of the lens. So rays passing through the periphery of the lens are deviated more than those passing through the para-axial zone of the lens. So now the correction of spherical aberration. Spherical aberration may be reduced by occluding the periphery. Of the lens by the use of stops so that only the para-axial zone is used. Lens form may also be adjusted to reduce spherical aberration. For example, plano-convex is better than biconvex. Plano-convex is better than biconvex. To achieve best results, spherical surfaces must be abundant in the lens's ground with aplanatic surface. That is, the peripheral curvature is less than the central curvature. This is aplanatic aspheric curve to correct spherical aberration. Another technique of reducing spherical aberration is to imply a doublet. So, to imply a doublet, this consists of a principal lens and somewhat weaker lens of different refractive index. They are cemented together. The weaker lens must be of opposite power, and because it too has spherical aberration, it will reduce the power of the periphery of the principal lens more than the central zone. So they are made up of opposite powers. Principal lens and somewhat weaker lens of different refractive index. Usually such doublets are designed to be both spheric and achromatic. Ocular spherical aberration. Ocular spherical aberration. The effect of spherical aberration in the human eye is reduced by several factors related to cornea, iris, lens, and retina. The interior corneal surface is flatter peripherally than its center, and therefore acts as aplanatic surface. The nucleus of the lens of the eye has a higher refractive index than the lens cortex. Thus, the axial zone of the lens has greater refractive power than the periphery. Furthermore, in the eye, the iris acts as a stop to reduce spherical aberration. Impairment of visual acuity that occurs when the pupil is dilated is almost entirely due to spherical aberration. So the optimum pupil size is 2 to 2.5 mm. Next is Stiles-Crawford effect. So the retinal cones are much more sensitive to light which enters the eye paraaxially than to light which enters obliquely through the peripheral cornea. This is Stiles-Crawford effect. This directional sensitivity of the cone photoreceptors limits the visual effects of the residual spherical aberration in the eye. Oblique astigmatism. It is an aberration which occurs when rays of light traverse a spherical lens obliquely. When a pencil of light strikes the lens surface obliquely, a toric effect is introduced. The emerging rays forms a stromsconite with two lines of foci. In between is the circle of least confusion. Oblique astigmatism occurs with spectacle lenses when the line of sight is not parallel with the principal axis. This is the principal axis. This is unavoidable in the case of the near portion of a multifocal lens. It may also be a cause of reduced acuity in patients with restricted eye movement who adopt a compensatory head posture and look obliquely through the peripheral portions of their spectacle lenses. Obviously, the higher the spectacle lens power, the greater the unwanted cylindrical power induced by the aberration. So, the higher the spectacle lens power, the greater the unwanted cylindrical power induced by this aberration. In daily life, adults spend most time looking slightly downward from the primary position, and spectacles are therefore made with the lower borders of the lenses tilted towards the cheek. Here you can see. This is pentoscopic tilt. This also slightly reduces the obliquity of the reading portion of the multifocal lens. However, it may be a cause of intolerance in high-power spectacle wearers. If new frames are dispensed which have a different angle of pentoscopic tilt from the patient's previous glasses. Furthermore, oblique astigmatism is considerably affected by the form of the lens used. It is much worse in the biconvex and biconcave lenses than in meniscus lenses. Calculations have been made and tables compiled indicated the optimum form of single lenses for reducing both spherical and oblique aberration. Such lenses are known as best form lenses. And they are usually in the meniscus form. They are usually in the meniscus form. This is the meniscus form. Ocular oblique astigmatism. This aberration occurs in the human eye, but its visual effect is minimal. The factors which reduce ocular oblique astigmatism are the aplanatic curvature of the cornea reduce oblique astigmatism as well as spherical aberration. The retina is not a plane surface but a spherical surface. In practice, the radius of curvature of the retina in the emmetropic eye means the circle of least confusion of the strom conoid formed by oblique astigmatism falls on the retina. Finally, the astigmatic image falls on the peripheral retina, which has a relatively poor resolving power compared with the macula. Compared with the retina at the macula, visual appreciation of the astigmatic image is therefore limited. Coma aberration. Coma is really spherical aberration applied to light coming from points not lying on the principal axis. So rays passing through the periphery of the lens. They are deviated more than the central rays and come to a focus near the principal axis. This results in unequal magnification of the image formed by different zones of the lens. The composite image is not circular but elongated like a coma or comet. Correction of coma aberration. As in the case of oblique astigmatism, this aberration can be avoided. This aberration can be avoided by limiting rays to the axial area. Of the lens, and by using the principal axis of the lens rather than subsidiary lens. Ocular coma aberration is not of practical importance for the reason given under oblique astigmatism. The factors which reduce ocular oblique astigmatism: low order aberrations, myopia, hyperopia, astigmatism. Image distortion. When an extending object is viewed through a spherical lens, the edges of the object viewed through the peripheral zone of the lens are distorted. This is due to the increased prismatic effect of the periphery of the lens, which produce uneven magnification of the objects. A concave lens caused barrel distortion. This is caused by concave lens, while a convex lens causes pincushion distortion. So this is formed by convex plus lens. These effects prove a real nuisance to wearers of high power spectacle lenses, for example aphakic patients. Curvature of field. The term curvature of field indicates that a plane object gives rise to a curved image. Curved image. This occurs even when spherical aberration, oblique astigmatism, and coma have been eliminated. The effect is dependent upon the refractive index of the lens material and the curvature of the lens surface. Ocular curvature of field. In the eye, the curvature of the retina compensates for the curvature of the field.